Doctors of Reddit. What's the biggest case of faking it you've ever seen? Taking trauma call during surgery residency. Had a prisoner come in after a fight and claimed he couldn't move or feel his legs. All the CT scans and MRIs were normal. But we would shield his legs so he couldn't see them and poke them with needles and other sharp objects. With enough force to cause pain, he never flinched or moved his legs at all. He was diagnosed with severe spinal cord injury without radiographic abnormality. He stayed in the hospital for a week. No improvement. Always had one guard with him. One night they were down in the lobby watching some television, but the guard needed to use the restroom. The patient said, "Where could I possibly go? I'm paralyzed." Guard left him alone for 2 minutes. Patient last seen sprinting down the road. Naked butt cheeks flapping in the breeze. Made it to a city 4 hours away by car before he was caught again. I have never seen anyone fake it so well. Truly playing the long con. Dermatologist here. Patient was convinced she had a melanoma and needed a biopsy and would need to be on workers' comp. I told her it looked like ink from a marker. She demanded a biopsy. I wiped the area off with an alcohol swab and showed her the ink and that there was no spot on her skin anymore. She stormed out threatening to sue. I'm just glad I cured her melanoma. Had a patient come in for a fall who now couldn't move their legs at all. Did a bunch of tests. Didn't find anything. The patient was not at all fazed by suddenly being paralyzed, which was the first red flag. Didn't really believe anything was wrong, but the patient was still not moving their legs. My options are to admit for a huge workup or get them to walk. So I update them saying everything is fine. Tests are negative. You can go home. Patient gets up. Gets dressed and walks out without a word. We had a patient faking a seizure, so my supervisor told one of us to get the brain needle. The patient made a miraculous and swift recovery without intervention. That's the best part about most of these stories. When they make up some form of fake machine so that the patient stops faking. Cracks me up every time. Fake problems require fake solutions. Physical therapist here. Working mom comes into the clinic with her infant in a stroller. She's limping like she's got a nail in her foot. Wincing in pain and tears in her eyes. She's crying during her visit with the PT. None of us think she's faking it. She limped out of the clinic. I glanced out of the window and saw this woman bounding down the sidewalk. Hips swaying. Full stride. Going places. We were all fools. Whenever we had kids, usually teenagers, playing up their symptoms to extend their hospital stay, we would order them into a healthy lifestyle. Lights out at 9. No screen time for 2 hours before bedtime. Healthy diet chock full of fruits and vegetables. Screen time limits. Minimum number of laps around the unit per day to get in their exercise. They got better so much faster with our healthy lifestyle tips. My brother was an EMT for 2 years and he told me this. People will try to use the ambulance as a means for transportation from Fulton to Oswego because the hospital is in Oswego. By faking seizures. Sometimes when the head EMT guy was feeling fun and knew that the person was faking, he'd say something like, "Man, it's weird that he's having seizures but not peeing himself." Apparently the person would kind of snap out of it for a second. Weigh up the repercussions. Then either pee themselves or stop faking. I thought that was hilarious. Sorta along the same idea. Working at a pharmacy, we saw a guy come in to try and get a refill on some pain meds that had no refill. After pleading that his ear really hurt, we told him again we couldn't refill it. One of the other employees saw his step into a side hallway and take a pencil and jam it forcefully into his ear repeatedly. Drawing blood. He calmly left and went to the ER. He came back a few hours later with a prescription for pain meds. This patient comes in for back pain with weakness of the legs. Gets a full workup with MRI, standard blood work, and then some immunological things to look for stuff like myasthenia gravis. No neurological or immunological explanation for the weakness. Patient is seen by physical therapy and they are of the opinion that the patient is holding back intentionally. Go to see the patient at the end of the day and prep them for discharge. Patient is infuriated that they're being discharged. Yelling and screaming about how they aren't better. How they're disappointed in the institution. Blah blah blah. They said one particular thing that still clearly stands out 3 to 4 years later. I can't believe you're sending me home already. I haven't even told my family I'm here. And now you're going to send me home before they even have the chance to see me. My attending and I leave the room to arrange things with the nurses. We go back in and the patient is out of bed and standing up in the middle of the room. Miraculously the patient is able to walk with zero assistance when they had so much difficulty with any assistance over the previous 2 days. At that point, they were enraged. We went into the room without knocking. They were discharged home after a conversation regarding abuse of medical services. Was the patient's goal to have their family see them in the hospital? I could see that. A couple of my more socially isolated Facebook friends tend to post hospital selfies with captions like "interesting night." Because they need some attention and haven't learned healthy ways to get it. The tearful family visit could be a big deal if what the patient really needs is a hug. Had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated hello wave. She started to throw her arm up to but caught herself halfway through. Then threw her hand back into her lap and pretended to be staring off into nothing. I would never have expected pretending to be blind to be such a commonly faked issue. But reading this thread has changed my mind on that. Nurse for an ophthalmologist here. Had a 21-year-old new patient claiming to be completely blind from a sudden and severe glaucoma diagnosis from a previous unknown doctor. Would feel around while walking. Tried to keep eyes rolled back into his head. The whole 9 yards. He said he is a famous YouTube rapper that is now unable to make videos or earn a living. I exclaimed to have heard of him before and very excitedly asked him to search and show me his YouTube channel on my phone so that I could subscribe. He took my phone out of my hand and effortlessly found the YouTube app and typed away in the search bar. Oh. And of course his eyes were back to normal and focused. I am amazed he didn't ask for a discount. Or to have a free checkup for some exposure. One time my roommate who is an ICU nurse came to see one of my indoor soccer games. During the game a player on the other team went down hurt and starting screaming in pain and swearing and rolling around while holding his ankle before he was eventually helped off the field. He then limped over to where the fans sat and watched the rest of the game brooding in silence before he left early. After the game my roommate told me he was going to go over and see if there was anything he could do to help. Until he saw that the guy was limping on the wrong leg. Was told this one by a fellow nurse I used to work with when we had a psych floor. It's not unusual for psych patients to stash things in various orifices. This one woman was convinced she was impregnated by a ghost-like figure but no one would believe her. So one day she started complaining of massive pelvic and uterine pain. She called them contractions. So the doctor goes to do an exam. The doctor feels something larger in there so they prep a table to get the object out which was quite large. So the wonderful third year helping with the procedure starts hearing this woman complain of contractions and yelling things like "Should I push? I'm gonna start pushing. Doctor trying to work forceps around this woman's parts as to not hurt her. Finally goes God. And as he starts saying it, he pulls out a baby doll. Head only. The poor med student did the wobble. Went all flush. Had problems keeping balance and about took a dive. I was told he didn't live that down the whole rotation.